All right, Mr. D, I know you're excited to get out of here. We've got some discharge instructions for you here right fast for your medications. Just want to go over them real fast and then we'll let you go. Sound good? Great. Okay. Let's go over your home medications first. Your levothyroxine, it's 100 micrograms. Now, this is going to treat your hypothyroidism, your low thyroid hormones. Sure, you know you've had that for a while. Got that going on. It's 100 micrograms daily by mouth. Okay. Now, you're going to take that first thing in the morning on an empty stomach, at least a half hour before breakfast. Take that with a full glass of water, and avoid taking any iron supplements or any calcium and antacids within like 4 hours. Okay. Now, some of the side effects: it's going to be nervousness, irritability, increased heart rate, and trouble sleeping. Kind of a bummer on that, but it is what it is. Now, if you run into anything like chest pains, irregular heartbeat, or shortness of breath, contact your primary care provider, and they'll give you further instructions if you happen to run into that. Now, if you miss a dose, take as soon as you remember it, unless it's within close to the next dosing, and do not double dose. Your day is gonna go sideways if you do that. Your Protonix, your metoprolol, 40 milligrams. That's going to reduce your stomach acid, treating your GERD, and nobody likes that. You're going to take 40 milligrams once a day by mouth. Okay, pretty simple. Take it before a meal, preferably in the morning. And that'll keep you going all day. Swallow it whole, don't chew it, because it's just nasty. It's gross. Some of the common side effects are headache, diarrhea, and nausea. So if you experience any of those, kind of pull back. If you experience severe diarrhea, any muscle cramps or weakness, or any irregular heartbeat, okay, regular heartbeat, contact your primary care provider. Just do it right then, because we want to take care of that. Take if you remember it. If you miss a dose, take it when you remember, unless it's close to the next dose, and then just kind of kind of wait for it. The new medications, all right, your metformin, that's going to treat you, it's going to control your blood sugar with your diabetes. Okay, it's going to be 500 milligrams once a day by mouth. All right, and take with meals. That's going to keep the stomach upset from building up a little bit. Don't skip doses. Okay, keep really try and maintain that schedule. Some of the common side effects: nausea, diarrhea, and the stomach upset. Hopefully the Protonix will help with that. If you get anything like unusual fatigue or muscle pain, trouble breathing, okay, if you get any of those, especially the trouble breathing, do not hesitate. Contact your primary care provider immediately. All right. If you miss a dose, take it with the next meal. If it's near an upcoming dose, don't worry about it. Just take it when your next dose is due. Okay. Your metoprolol. All right. It's your low pressor, 50 milligrams. It's going to lower your blood pressure and your heart rate. Okay, keep that in mind. Right, so 50 milligrams once a day by mouth. Right. Take with or immediately after meals. Take it at the same time daily. Okay, that's going to be a big help to you in the long run. If you get anything like fatigue, dizziness, slow heart rate, it's kind of a common side effect. But if that turns into fainting or shortness of breath, or you get any edema, get any swelling, hands, your feet, your ankles, contact your primary care provider. Take it when you remember, unless it's close to the next dose, and then it's the same thing with everything pretty much we're going over today. Just hold on until the next dose. Your lisinopril, your Zestril, 10 milligrams. That's also going to treat your high blood pressure. It's going to protect your kidneys as well. 10 milligrams by mouth. Okay. Take it with or without food, but take it at the same time every day, and try and get a little bit more water in you. Not an additional pint down the pub. Just water is best. Some of the common side effects can be a dry cough, dizziness, headache. All right. Now, if you get any swelling of the face, the lips, the tongues, especially, that's don't even call. Just go to the ER. Just do not pass go. Do not collect $200. Also, if you get any severe dizziness, or if you find you're not peeing as much, okay, contact your primary care provider. Same song and dance. Take it if you remember it. If you miss a dose, unless it's near the next dose, again, don't double up on these either. Okay. All right. So everything we've gone over, these are yours. These put these in the bag with your water. Now, some of the general highlights. I know I went through those fast, but you got the printouts for you to refer back to, and we're gonna kind of go over some of the stuff here and now. Try and avoid taking antacids with calcium or iron before you take the Synthroid. Okay, it'll negate some of the effects, and you don't really want to do that. Monitor your blood sugar regularly with the metformin. Okay, especially with you start your treatment, you're not really sure how you're going to respond, so keep an eye on that. Combining the blood pressure medications may cause dizziness, so you may feel that like lightheadedness when you stand up quickly. Try and avoid moving quickly. Move slowly, move controlled, and keep yourself safe. Any medications, any over-the-counter drugs, any supplements, let your primary care provider know. Okay? Keep them in the loop, because they're the ones that are they're feeling the whole ball. Just some general instructions: don't skip doses. Okay, medications work best when they're taken consistently. Try and keep a daily medication schedule. It just helps. I think we're getting to that point where we need to keep a little post-it note or one of those pill organizer things. It beats the alternative, I suppose, but it is what it is. Try and monitor your blood sugar levels, your blood pressure, especially. You may want to take a look at some of the diabetic diets that are out there. Things like Start Diet, pretty popular. But find one that works for you. Be glad to give you some phone numbers before your discharge is finalized, so you can kind of talk to some people, get some ideas. Okay. Call your doctor or go to the emergency room if you ever experience chest pain, shortness of breath, fainting, or severe dizziness, signs of allergic reaction, swelling, rash, difficulty breathing, especially, or if your blood sugar goes very high or very low, and that's going to be, you're going to feel dizzy, you'll know. Pretty much, you will know. Any chest pain, shortness of breath, go. Try and store them in a cool, dark place. Medicine cabinet should be fine. Keep out of reach of children. Don't use the expired medications. If you do find that some of these medications get to the point where they're expired, you can drop them off at a local pharmacy. I think there's a few other options. I don't know the ones locally, but I think there's a few other options that you can take to dispose of these properly. Don't put them down the drain. We've got other problems with water in this area. If they're not unavailable, you can mix coffee. You can mix medicines with coffee grounds, cat litter, placed in a sealed bag and discard in the trash. Do not flush medications, like I said. Any follow-up care? Please schedule follow-up appointments with your healthcare provider as needed. You may need to follow up with some routine lab work, some thyroid levels, your kidney functions, and of course with the diabetes. I'm sure you've heard enough about your A1C during your admission to last a lifetime. Okay. Any questions so far? All right. Good. If you have any questions about your medications once you're discharged, contact your healthcare provider or your pharmacist. All right. Any questions? Great. Fantastic. All right. We will get this put together, squared away for you. We'll get you some transport and we'll get you out of here. Sound good? Great. All right.